Live from the Fox Television Center, this is Good Day LA.
Good morning. We have all kinds of things for you this morning on Good Day LA. After all the controversy and safety concerns, there's a brand new technology for breast implants. We'll show it to you. And implants are back. Breast augmentation surgery is once again extremely popular. We'll show you the newest techniques and some women very happy with it. Good morning. Welcome back to Good Day LA. Queen Latifah coming up in a couple of minutes. You are certainly were in the last few years have been great controversy over breast augmentation surgery and breast implants. There have been some big changes made, and Jean Martirez is here to report on that. Jean?
You won't believe the things they're coming up with now. And I'm going to tell you all about it. Today, more women are having breast augmentation after a decline in interest, of course, after the silicone scare a few years ago. Implants are back. In fact, augmentation is the third most popular plastic surgery. Today, doctors are looking at new ways to make scarring practically invisible. They're also studying new materials for implants.
Every woman I know who has implants is thrilled. Everyone I talk to, I love them, you're going to love them, you're going to have so much fun. It's the best thing I ever did.
Okay, Christina, I'm going to mark you.
Now it's Christina Kelso's turn. Hers is a typical breast augmentation. Less common is where the incision is made. The standard entry points are underneath the breast, under the arm, and one not as widely known through the areola or nipple.
We do it right where the colored portion of the border, the colored portion meets the rest of the breast, and there's sort of a natural border there, so we place the incision right on that border, so it's very well camouflaged.
Scar-wise, I'd just rather have it at the areola. It'll blend better, and it makes more sense in layman's terms to me.
Nancy Board had it done almost 2.5 years ago. She saw very little scarring.
And there are little white lines. And it was amazing to me because I thought I would have some type of scar that, that you would be able to see. But there's really none. You have to be very close to see it.
After a small incision's made, the implant is partially filled with saline, inserted, and the remaining fluid pumped in. It's a clever procedure, but Dr. Malcolm Lesavoy, chief of plastic surgery at Harbor UCLA Medical Center, feels it has disadvantages because the surgery invades the breast gland.
Later on, maybe 6 months or a year or 6 years later, one may detect a lump or a bump in that particular area, and it's difficult sometimes to ascertain whether or not that is from the surgery itself or if it is a breast lump itself in the gland.
We've not seen that be a problem. Again, you go through a very, very small amount of glandular tissue. It's really a very short amount, and you're really going straight through it. And the two edges of the gland heal right together. So it's not been a problem.
In fact, Dr. Lent is looking at yet another incision point through the belly button.
And if we can do it with the same high standard we can do it through the other incisions, then it'll be a wonderful technique.
While doctors are looking for new entry points for implants, there are others who are looking for new implant materials. Meanwhile, people like Christina Kelso and Nancy Board are satisfied with saline.
I'm very, very happy about it. Very, very happy about it.
A lot of women very happy. Average cost for breast augmentation is anywhere from $5,500 to $8,000. It's not cheap, but as we said, a lot of folks very happy with the procedure. In coming segments, we'll look at a brand new facelift technique, which leaves virtually no scars. Got to see that.